Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is borderline personality disorder really a trait disorder? So to answer this question, I'm going to be using a study that was published in 2018 by Conway and colleagues. And this study used data that was gathered during the collaborative longitudinal personality disorder study. So we see this referenced on a number of different articles. So first I'm going to take a look at borderline personality disorder and then compare trait versus state and then look at the results from the study. So with borderline personality disorder, we know this is a cluster B personality disorder in the Diagnostic and Statistical Manual. This is in the dramatic, emotional, and erratic cluster. And there are 9 symptom criteria we see in the definition of borderline personality disorder. Frantic efforts to avoid abandonment, unstable relationship pattern, identity disturbance, impulsivity in at least 2 areas that could be self-damaging, suicidal behavior, gestures, threats, affective instability, chronic feelings of emptiness, inappropriate, intense anger or difficulty controlling anger, and paranoid ideation or dissociation. Now, borderline personality disorder is usually conceptualized as a trait disorder. As a personality disorder, as the name would indicate, it's considered to be stable over time. So a lot of times when we think about borderline personality disorder, we think of a set of symptoms that don't tend to change much over time. It's also conceptualized by many clinicians as difficult to treat, a chronic disorder. But we know from prior research that the remission rate for borderline personality disorder over a 10-year period may be as high as 85%. Now this means that individuals who did meet the full criteria for the disorder no longer meet it after 10 years. About 85% of the time. But interestingly, this doesn't mean that the overall functioning improves much. So we see kind of mixed results here. A fairly high remission rate, at least as we would normally conceptualize borderline personality disorder, but functioning that tends to still remain fairly low. We also know with borderline personality disorder that the severity level of the symptoms tends to change quite a bit. Now this doesn't necessarily mean it's directional, like the remission information, but rather there's a lot of trait instability, more trait instability than we see with other personality disorders. So this brings me to the comparison between trait and state. In this study, sometimes we see it referred to as stable versus dynamic. We also see the word state sometimes referred to as an occasion factor. But generally, we usually think of these as trait versus state in terms of the terminology. And what this means is there's a stable part of mental disorders. That's the trait part. And there's a part that tends to be more situational. That's the state part. So with the trait part, specifically in this study, they refer to the trait component as borderline proneness. This is a chronic susceptibility to borderline personality disorder symptoms. This is referred to as time invariant, so it does not change over time. And usually we think of this trait component as more based on genetics, personality, characteristics, or an unchanging environmental condition. Now, the state component, as I mentioned before, sometimes called occasion factors, is not constant over time. It's time varying. So this is a time-specific situational characteristic. Even though it's not fixed over time, the symptoms we see that are referred to as state symptoms may still be persistent. That's because the stressor could stay in place. For example, with borderline personality disorder, an unstable relationship could last many years, or a stressful job. So these environmental stressors may be constant, so it can make a set of state symptoms, the occasion factors, appear to be more like traits. So keeping in mind that borderline personality disorder is usually conceptualized as a trait disorder, what were the results from this study? Well, the way this study worked was that they looked at the contribution of trait versus state to borderline personality disorder. So they tried to figure out what percent of the factors were trait factors and what percent were state factors. So one might think that borderline personality disorder, that the finding here would be that it's almost all trait-based. But actually it's only 45% trait-based and 55% state-based. So a very surprising finding given, again, how we conceptualize borderline personality disorder. There were several other interesting findings with the study as well. Childhood maltreatment And here it was defined as neglect, abuse, and witnessing violence, because these are the types of childhood maltreatment that we believe may lead to borderline personality disorder. Overall, childhood maltreatment was a strong influence on the borderline proneness piece, so the trait piece, and had almost no influence on the acute fluctuations in symptom severity, the state piece. So childhood maltreatment seems to be much more related to trait than state. Now, in terms of negative temperament, which we sometimes relate to the neuroticism trait on the 5-factor model, this was found to have a strong influence on borderline proneness, on the trait side. Now, this part is consistent with a lot of prior findings. Again, we conceptualize borderline personality disorder as a personality disorder, as one related to personality traits. Neuroticism is a trait, and of course we think of borderline personality disorder as an extreme set of traits on the 5-factor model, including high scores in neuroticism, low scores in conscientiousness, and low scores in agreeableness. So this particular finding with negative temperament wasn't really that surprising. Now, the findings on trait versus state related to disinhibition were surprising. So when we think of disinhibition in borderline personality disorder, we're oftentimes talking about the impulsivity symptom criterion and the suicidal behavior symptom criterion. Disinhibition was found to be twice as strongly related to state than trait. So usually when we think of disinhibition, of course, we think of this as more trait related. So outside the specifics of these findings, what can we learn from this study? Well, a lot of times when somebody's being assessed for borderline personality disorder, clinicians are reluctant to diagnose the disorder if the symptoms tend to come and go. They think more of mania or substance abuse or some other disorder instead of borderline personality disorder. And the results here from this study show us that borderline personality disorder shouldn't automatically be ruled out when symptoms tend to come and go, because a large component of the disorder has this state property to it. Something else we can learn from this paper would be applied to treatment planning. So during treatment planning, it may be important to distinguish enduring symptoms from acute symptoms. So the assessment of borderline personality disorder, as is the assessment with all personality disorders, needs to be something where we use caution and we really try to figure out what the symptom patterns are. Are they trait patterns or are they state patterns? I hope you found this description of borderline personality disorder and its relationship to trait versus state to be interesting. Thanks for watching.